I will introduce Birgit next. Our last speaker is Birgit Umaigba. Birgit is an ICU registered nurse and clinical practice instructor at Centennial College. She is a passionate nursing leader and a strong advocate for equitable healthcare. She's an emergency room and critical care registered nurse, as well as a clinical practice instructor at Centennial College. Birgit envisions a diverse nursing workforce where different cultural groups are represented in leadership and academia. I'll add that Birgit has a strong voice in advocacy. I've seen Birgit be loud on Twitter and as a guest on television news programs. I mean, loud in the best possible sense, advocating for equity in nursing, safe nurse to patient ratios, nursing best practices. So thank you, Birgit, for being here today.
Thank you very much for having me. And I just want to thank the speakers. You highlighted very important data, and I need some days to actually digest all of those. So thank you so much for highlighting the present issues in this pandemic right now. So I'm gonna pivot to nursing, and my focus is actually nursing, as you've heard. I was actually looking through the data out there when it comes to nurses in Canada, and there isn't much actually, but I did find some surveys that were done. So the College of Nurses of Ontario, which is responsible for holding nurses accountable to practice in line with standards and to protect, actually have mentioned a recent Statistics Canada survey of 18,000 healthcare workers across Canada, which revealed 7 in 10 healthcare workers reporting worsening mental health as a result of working through the pandemic. Of the healthcare workers surveyed, nurses in particular reported declining mental health, with 37% saying they have poor mental health compared to 27% of physicians. And I did also look through the Registered Nurses Association of Ontario's survey, which was conducted between January 29 and February 22nd of last year, and captured responses from more than 2,100 registered nurses, nurse practitioners, and nursing students working in Ontario and in all domains of practice and across all sectors of the healthcare system, so including hospitals and long-term care. I think the main part of that survey to me was that at least 13% of registered nurses aged between 26 to 35 years of age reported that they were likely to leave the profession. And the information is out there, and I believe the provincial government is aware of this information, because nurses have been pretty loud and clear through organizations and individual nursing voices in reporting on the harms of poor policies to our healthcare system as we speak. And there's been a complete inaction when it comes to, making changes when it comes to healthcare and protecting patients with proper staffing and also nurses. A lot of nurses actually do report decreasing mental health. Just from practicing at the bedside, a lot of my colleagues are dealing with anxiety, depression, sleepless nights, and this is actually from witnessing people dying along with our family members, the stress of the job, constantly working short-staffed, increased workload. So we are having nurses looking after more patients that we typically would be looking after, because we have areas of emergency departments completely closed because we don't have enough staff to provide care. And I'm sure a lot of people have heard on the news that we have more beds coming to hospitals. However, we do not have staff to staff those beds. They're just basically furniture. So nurses were feeling the guilt, the moral distress of not being able to provide quality care to patients. We have patients who are sitting on their briefs for hours and not getting nurses, reach them just because we don't have enough staff. And this is causing a lot of pressure on nurses. I've had to cut back on my work hours as well because it was impacting my mental health and my physical well-being. I had to cut my hours, and a lot of my colleagues have done that as well. We've had nurses quit to other areas, from bedside to administration to occupational health. anything outside of direct patient care. We've had nurses retire early, and I would like to see more statistics actually of here in Canada. So I didn't really want to delve into what was happening in the States or other parts of the world for this presentation. So, in terms of the evidence, we know that the evidence is clear. There's a link between precarious work and the mental health of healthcare workers. Majority of nurses do hold precarious positions. Nurses working part-time, casual positions. There's no, believe it or not, a lot of nurses do not have full-time jobs. And I know you hear on the media we're in need for nurses, but most employers take advantage of nurses by not hiring them full-time so they don't grant those full-time benefits like paid sick days or mental health resources and all of that. And we know that precarious work is a key driver of the pandemic, and failing to improve working conditions has widened existing health inequities. Ontario is now in a sixth wave, and hospitalizations due to COVID-19 are rising. Last Tuesday, the province reported a 20.6% spike from the day before, while ICU counts rose 4.4%. So, nonetheless, despite all of this information and call from experts, the provincial government is pushing to lift all restrictions while leaving workers behind with no protections. So there's a clear failure to learn the lessons of the pandemic, and it's past time that we address the working conditions that have undermined the public health care system and also the health and well-being of nurses, doctors, personal support workers, respiratory therapists, every single person working in healthcare, as well as the health of patients. Um, we've been calling for paid sick days for the government to legislate paid sick days so nurses are not forced to go to work sick. We have nurses actually going to work sick, and this is further impacting the mental health of the staff that show up and those who actually have to bear the burden when they eventually call in sick and get sick for a longer period of time. We also need immediate action to ensure healthy wages and hours and more permanent full-time jobs, because we know that racialized workers are overrepresented amongst essential and low-wage jobs. A lot of nurses are women, women of childbearing age and women with children and responsibilities. A lot of the nurses as well are racialized workers. And we know that the inequities that this community face are a lot more than regular Canadians. According to recent data, more diverse neighborhoods had 3 times the rate of COVID-19, 4 times the rate of hospitalization, and ICU admissions, and double the mortality rate. This is from Public Health Ontario. In Ontario, racialized women earn 58 cents on the dollar compared to white men, while racialized men earn 76% for every dollar earned by white men. And we also saw the crisis in long-term care, which revealed the long-standing crisis of precarious work. This did not just happen. It's been a years of underfunding and always taking away from the system without building the system to respond appropriately to something like a pandemic. The conditions that have driven spread in other sectors as well, both in acute care and other areas of our healthcare system. Some of my patients that I looked after were personal support workers, working multiple jobs, going from one facility to the other. Unfortunately, I looked after colleagues who contracted COVID-19 and are now disabled from COVID-19. And we know we don't talk much about long COVID, but long COVID is real. I know people, we actually have colleagues, nurses, PSWs, who contracted COVID-19 at work and are now living with disability, long-term disability, long COVID, and further placing them at a disadvantage in the society. When it comes to paid sick days, there's so much statistics to show that paid sick days save lives. Paid sick days are an effective public health measure, and they actually do impact the health and well-being of workers. We have As nurses who do not have full-time employment or further marginalized by the system because they have no access to paid sick days, going to work sick, a lack of adequate paid sick days also undermine vaccination strategies. There had to be a call for nurses or workers in general to have time off to go get vaccinated. A survey of Ontario Healthworkers found the vast majority wanted the vaccine, but 64% were worried about losing pay to get the vaccine or to recover from the side effects, and 68% were more likely to get the vaccine if these costs were covered. Um, we hear about poor working conditions all the time, but most nurses bear the burden of these working conditions and are also forced to remain silent about poor working conditions. We do know that this impacts the health and well-being of everyone in the system. During the first and second waves of the pandemic, it was eye-opening for me to see how much the social determinants of health impacted nearly everything in our lives. I was seeing a lot of patients who work in precarious jobs without paid sick days. I saw patients who were working in gig jobs like driving for Uber. Some of my patients were personal support workers, like I mentioned before. Some of these patients actually mentioned that they had to go to work sick because they lacked access to paid sick days, and some of them contracted COVID from colleagues who came to work sick. A lot of them were racialized or immigrants. So one of my peers, the story remains with me and I share it all the time. One of my PSW patients shared that they've been asked on multiple occasions during the pandemic to sign documents binding them not to report their situation to anyone or they'll lose their job. We know when immigrants are threatened in this way, or anybody is threatened in this way, they were silenced. They will never speak up because they want to be able to put food on the table and a roof over their heads. If we're not allowed to talk about horrible working conditions, we not only compromise our own lives and licenses, we also compromise the lives of the people we look after. We had cases where patients eventually got infected from staff who went to work sick. Some of these patients were immunocompromised and then ended up with complex health needs. We need freedom to be able to speak for our mental health and for the well-being of our patients. And we are not seeing this. The government is continuing to fail nurses through the lack of repealing Bill 124. The refusal to repeal Bill 124 has caused nurses to leave the profession in droves. And right now we have a complete crisis situation where multiple units in the hospitals are not having enough staff. As of today, my local hospital had a call out for nurses to come just to provide care in any area: ICU, emergency room departments, medical surgical departments. That is crisis. I cannot tell you the impact it has on everyone. So this is further putting pressure. This is putting further pressure on our health, and we're seeing nurses getting, just permanent, I would say nurses are going home in tears. People are crying at the nursing station, and this has definitely changed the look of the profession for good, because most people think that the profession is actually causing destruction. So this they continues to be a call out for on the government to fund a healthcare system, particularly to fund the resources that are available for nurses to provide to have access to mental health support, and that includes repealing Bill 124. Thank you very much.
Thank you, Birgit. Thank you so much for speaking so passionately. And I can't help but notice that I asked you here to speak about mental health, and you advocated beautifully for nursing, but you also mentioned your patients, advocating for your patients. And isn't that it just goes to the core, the heart of what nursing is about. Okay. I noticed that John shared in the chat a study, a study in the chat, pardon me, the impact of COVID-19 pandemic on mental health of nurses in British Columbia. Have you seen that study, Birgit?
Yes.
Okay. So if John is really well versed in finding studies, if that's all John is sharing, I
Oh,
think that might be all there is then.
oh no, I haven't seen this one. I saw the one from Columbia University
Okay.
in the United States.
Okay.
Thank you, John.
But if John is just sharing that, I'm guessing that's all he found. He is a whiz with finding studies.
I had another one also further up,
Oh, okay, I missed
the
it.
healthcare one. I can put in the general worker one also if you're interested.
Thank you.
So in terms of, if anyone has any questions for Birgit, please put it in the chat. I'm just going to open up. I was saving the questions in the chat from the past speakers, so I'm just going to pull them up. Call MPPs. Yes, call MPPs. That is definitely can be very effective when they hear from their constituents. So we had a lot of questions that were, I think, a same theme around do you feel going back to the classroom was better? Why are teachers feeling unsupported? And I just want to extend that to anyone. What are the themes around what causes or what can help any worker in a frontline sector or any sector to feel supported? What can their employer do? What can their colleagues do? So I'm going to open this up to any of our panelists if you want to address this. And John, this is open to you as well, if you'd like to speak. What can be done to support workers when they're going through stress, whether it's a pandemic or any stressful situation?
I could start a bit from the education workers' perspective. The particular government in Ontario did not use joint health and safety committees at the workplace and did not use the provincial working group on health and safety very effectively. Even the organization People for Education was pushing for some sort of table with all the stakeholder groups, including parents as well, to have people involved in the decisions that are being made. Also to have data being the reason why we change to increase precautions or release some of the precautions, people would be more confident. A lot of the timing of the precautions being added or taken away seemed to be arbitrary, and more recently it seems because there's a provincial election coming up. And so a lot of our members lose confidence if they don't think that the decisions are based on science and that they're not consulted in what would actually work in a classroom. Because some of the decisions, it was obvious that the people making them didn't know how classrooms worked. And so you have to involve the frontline workers in those types of decisions.
I think you could take any sector and say the person making the decision didn't understand how it worked. I feel like I've seen that shared amongst healthcare workers. Someone in the chat has mentioned they feel very similar issues by CUPW postal workers. It really requires knowing what the issues are, knowing the workspace, not just making an arbitrary or what feels arbitrary to the people actually working in it decision. I'm sure there was some logic. Well, I hope there was some logic, but in terms of when the actual person who has to do the work saying this doesn't make sense for my layout, there was a disconnect there.
I will jump in as the psychiatrist. Couple of things you can do to help people who are struggling. First, obviously, I'm going to advocate for better data. You can see the difference between low quality and high quality data when I showed the difference between the longitudinal studies and the cross-sectional studies. We have to take researching mental health seriously. It can't just be cross-sectional surveys. It can't be an afterthought. This has to be an active thing. But really locally, and I mean this, my whole life I'm working with kids in emergency departments, and they're coming to me with suicidal distress, and I'm a psychiatrist, and everybody thinks, well, you know, what do medications do? The far majority of my treatment involves genuinely talking to people, listening to them, and letting them know that I care about them and will do things to help them. And you know, I think a lot about the presentation that we just had about the nobility of nursing. These nurses have really sacrificed a lot to take care of Canadians, and it's an incredibly noble thing that nurses do. It is hard to be around a nurse that cares about you and not feel better. And it's really easy to be around a nurse that you can tell is either burnt out or just not on their A game and not really invested, and to feel uncared for. And so if you are going to reach out to someone in a spirit of caring, be genuine and have capacity. If you don't have capacity, seek capacity. And I can't understate this enough. When you ask someone how they're doing, please be prepared to follow up if they're not doing well, and please be prepared to substantially help them if they're not doing well. We need our governments and our local groups to take mental health far more seriously than a let's tweet about it and raise 25 cents per tweet type of idea. We do not need to talk about mental health anymore. We need to do things about mental health. And so my biggest plea to everybody is be a real human to those around you. If you see someone struggling, genuinely offer and support them. Be a charitable Canadian if you have capacity to do so. And if you don't have capacity to do so, find someone who does and seek help from them. The only way we're going to get through a lot of these problems is if as a society we decide they're important.
If I can jump in.
Yes, please, John.
Yeah, one of the studies that I put up there for the non-healthcare workers showed that those who were working at home were screening about 30% in the moderate to severe levels of anxiety, yet those who were going to work and yet had all their infection control practices needs met had half that level of anxiety symptoms, screening positive, whereas those who had none of their infection control practice needs met, almost 2/3 were screening positive. So we saw an immense gradation amongst the group based on whether or not their needs were being met. And I think this is often not thought of as a mental health intervention, but supplying people, making people feel safe at the workplace and confident in their infection control practices has, we found, seem to have a big impact in the frequency of screening symptoms.
And that goes to the support. So what can we do when we're not representing an employer to feel supportive? What tools are there? And some were dropped in the chat earlier by Kevin dropped ventilation assessment tool, but it's more than just the tools OCAL and others make. I struggle with how do we support each other if we don't have an employer on board, or we don't feel we have an employer on board. Sometimes there's that perception the employer might be trying to support, but not necessarily actually supporting. So there's that perception. And I just saw a couple comments. You need to have a strong and knowledgeable health and safety committee. Absolutely, absolutely. That is a part of it. What do we do if someone doesn't have a strong health and safety committee? And that's something OCAL is always trying to champion for better occupational health and safety in the workplace. John, do you have any other thoughts around that?
I was just going to put something in the chat. We did a study on health and safety representatives and try to look at what practices were more successful than others. And there were two types of orientations that we had come across over qualitative and quantitative research over time. And one was a technical legal approach to health and safety, where you're just looking at the rules and trying to follow the rules. And if you have a problem that the rules don't address, then you throw up your hands and say, we can't deal with that. The other approach is what we call knowledge activists, who would go and get the information from various sources and then organize their members in order to pressure the workplace to do the right thing. And these people were far more successful in achieving their health and safety goals. So one way is the orientation, what you expect from a health and safety committee. If it's just a bureaucratic necessity, boxes to tick off, or whether it's a real opportunity to connect with members, find the information to support improvements in the workplace. I'll put the link in once I get it.
Okay. One question that came up for Dr. Black earlier, there were two questions that were very similar. Do you feel going back to the classroom was better? And what are the causes of stress in school? What can be done proactively in school? I know this is more about the kids' focus, but I think there's a lot of people here who care about kids and would like to know.
Of course, of course. Well, prior to the pandemic, I was constantly advocating for us to recognize that school is a major source for kids. And I don't want to get too flippant about it, but I want you to think of all of the songs that describe summer that are things like School is Out for Summer. Are they sad songs or are they powerful, happy songs? The surprise that kids don't like school is not kind of earth-shattering. What people don't recognize that school is a major source of stress for kids. 36% of kids who die by suicide have a major educational problem. 83% of kids with anxiety disorders report school as one of the major contributors to their anxiety. If we don't look at schools as a source of quote unquote occupational health for kids, school is a kids' full-time job. The co-workers are their classmates, their bosses are the teachers, the supervisors are the teachers, the bosses are the principals. The work hours are the attendants. The difference is you don't see the pay for it. You don't get the compensation. I mean, there is a pay. There's lots of good things that school provide, but if we don't take the mental health harms of school seriously, we can never really solve this problem. And so I really encourage schools to develop mental health curriculum. We should be teaching kids, as importantly as we teach them algebra, how to handle stress, how to reach out for help, how to recognize signs of depression, what to do about child abuse, or if you're noticing something going wrong with a friend, how to solve relationship issues. And then more importantly, as we've returned to school during the pandemic, we saw a huge increase in emergency presentations to my hospital. And this was seen everywhere. It wasn't during the periods of lockdown, quote unquote, a lockdown in Canada, not really a lockdown, but it was during the periods of strongest protection that actually kids had the best amount of low presentation and suicide rates. And as kids returned to school, we saw those things spike up again. And I saw it even within 2022. Of course, we had an extra week of no school because of COVID shutdown for Omicron. It was about a week and a few days in BC, and I think 2 weeks in Ontario. And we saw this perfect case control study. Nobody was coming to the ER. And then the second school started again, kids were coming back to the ER. We have to seriously take how stressful school is for kids. And I'd love schools right now to be focused on connection, spending time together, learning the important things, having fun, taking breaks. Piling on the academics because kids have missed school is bizarre to me. I've just been watching endless people advocate against the importance of standardized testing in certain things. And then all of a sudden, when kids fall behind on standardized tests, we act like it's a big problem. We have to take their mental health really seriously. So it's a really complex question, but when you really think about it, you've always known that school is very stressful for kids. Every parent has always known this, and some kids thrive, but that's the minority of kids. Most kids have some form of challenge at school.
Thank you. And I know that that challenge is even greater for children with disabilities, LGBTQ2+, Indigenous, different persons of color. I know that they have additional risk factors. Well, I guess the risk factors, the discrimination.
I actually have the CDC just did an ABS surge. It's making a ton of rounds right now because it's showing a lot of child abuse. But I was able to break down and do a factor analysis. And if I remove sexual abuse as a historical factor, witnessing violence, a parental job loss, or all sexuality like LGBTQ as risk factors, I can bring the amount of sadness reported in that survey down from 43% to 9% by simply removing factors that are societal factors. If I remove whether or not they were in school, it does almost nothing to the sadness. So the societal factors behind childhood distress include things like bullying at school, how it is to be a non-heteronormative cis kid in school, how it is to go through physical abuse in the home or sexual abuse in your life. And we cannot tackle that by sending kids back to school.
Thank you. I just see a question. Has fear of contracting COVID been a confounding factor in the decreased emergency visits?
I think in the first month it would make sense to me. It doesn't make any sense to me given, like I can't imagine a parent in June of 2021 saying, okay, yes, you've just tried to kill yourself, son, but I'm not taking you to the hospital because of COVID. I could see that in the first month. I can see there being an effect there, but it's not realistic at all heading into the pandemic for the types of things that parents bring their kids to hospital for. So if a child's taking a serious overdose or they've engaged in serious self-injury for the first time, or they're telling their parent they want to kill themselves, I can't imagine a parent not seeking medical help because of fear of COVID, though there might be a few that have severe anxiety. I don't think it would show population-wise. So it's pretty unlikely.
Someone with that strong a fear or anxiety around the hospital there already were people with that much anxiety around hospitals.
Yeah, and we saw a huge drop in March, like a huge drop in ER presentations in March. And actually, we were prepared. I was at Children's Hospital in BC, and we were really prepared. I was like 7-day schedule. We had like the masses ready for mass casualty, and it was a ghost town at Children's Hospital. Like it was really quite empty for the first month. And so it's really realistic that in the first month, a lot of the drop was just the initial everybody holding up. But there's also an effect when it comes to mental health supports that when everybody's working together in a common cause, and remember, that was also a time when every 7 o'clock I would go to my patio and people would be cheering for healthcare workers, like literally brought a tear to my eye the first time it happened because I was very stressed. And then all of Vancouver was cheering for people working in the healthcare sector. So there's a pull together effect that happened during that time as well that we shouldn't discount.
Mm-hmm. Yeah, we've lost that pull together effect a little bit.
It's the opposite. I think we had protesters getting in our way, trying to get to work.
Yeah, and that's not unique to any one hospital. That's happened at a lot of places. And I even hear they went to some schools, unfortunately. Okay, so does anyone else want to address that? I was talking to Dr. Black a little bit more, but John, Birgit, or Tracy, do you want to talk a little bit about, or I can go on to the next question. Changing the culture and a climate of work structure as a preventative strategy. Would anyone like to elaborate on what they see that changing the culture and climate and work could be to alleviate mental health and stressors in the workplace? Noting that COVID is just one of many stressors. John.
Yeah, since it was my slide that Tracy so very skillfully presented, thank you, Tracy. There are, as Tracy mentioned, there's primary, secondary, and tertiary ways of preventing mental health problems in the workplace. And the tertiary way is try to help the victim, the person who has a problem. You have supports for them. You make accommodations for them. They get compensation, recognition, that type of thing. Secondary is when you're trying to deal with early signs, and often there's education sessions, there's mindfulness techniques and things like that. But the one part that's often missing in these workplace programs is to try to deal with it at the source. Is there a culture that promotes, let's say, competition over cooperation, or that promotes overwork, rewards that type of behavior, things like that? What are the values that the organization holds, that, and how do they impact the mental health of those who work there? And so these are tough things to deal with. You can't just write a policy and expect things to change. This means that people have to look at the way they relate to each other, the way they've organized the work. Sometimes it's simple things like being a little more flexible with hours of work so people can accommodate their needs outside the workplace. So there are many ways to do it. In Ontario here, we've had this I forget what it's called, where you're not allowed to be bugged after hours, work hours, with your cell phone. However, it's not a law. It's an obligation to discuss the situation in the workplace and find ways of dealing with it. So there are many ways you can deal with cultural, organizational, and structural issues at the workplace that can reduce workplace stressors. Tracy, did you want to add anything?
I'll just add a little bit from education workers' perspective. In the schools, every year there's a school climate survey that's answered that is for students and parents to be involved with. But when the educators answer that survey, the only questions are asked is about what is the climate like for the students. There isn't a survey that asks what is the climate about for the workers. And so like we hear about, bullying in schools. Well, there's sometimes bullying that happens amongst the adults in schools too, but there's no survey that tries to draw those types of issues out. And when the employers do try to address mental health, oftentimes they'll give resiliency workshops, how to handle it better, not how to deal with the problem itself. So we try to focus on empowering workers to push back a little bit, either through Joint Health and Safety Committee recommendations or just talking to their supervisor, to make sure their supervisor recognizes the psychological health and safety issues as well. There is a lot of compassion fatigue in education, probably in healthcare as well, and to look at those types of issues, because we can't help the students if we're not ready and capable of doing so ourselves. And as educators, we don't necessarily have a lot of training on how to deal with mental health issues, and that is needed as well. So some training like the mental health first aid, which includes like how to recognize and deal with on an initial basis anxiety and depression and even suicide, to make sure that educators know the limits of how to talk to someone initially and refer them to appropriate supports. Whether those people are our colleagues or the students, it would be important for all educators to get that type of training.
If I can just add one thing, I think workers need a right for self-protection. There were stories of teachers who, for instance, had 3 days off because they came to work with their own mask, an N95, when what was issued was the surgical mask. And the teacher had immunocompromised children at home. And there needs to be some logic. This bureaucratic gridlock which forces people when they come into healthcare facilities with N95s to take them off and put something inferior on it is just a symptom of when rule following gets in the way of common sense and self-preservation.
Birgit, I'll give the last comment to you.
Yeah, I just wanted to say, well, you said a lot of it. Sometimes we actually underscore the role of fair wages on people's mental health. I think just having more equitable pay, and I know that's really hard, but we're gonna keep pushing for that, does play a role in people's mental health. I remember when we had a few dollars added to our pay called the pandemic pay. The morale went up. Nurses did show up for work, and when people show up for work, you have less shortage, and work morale is better for everybody. And there's just a culture of always doing more despite the shortage. And there's a culture where nurses are pushed beyond their limits all the time. And there's this culture of not reporting increased workload because there's time constraint to actually report the working conditions. So it's just a cycle that continues, and nothing is addressed. So we're actually encouraging staff to report increased workload, and how that impacts their mental health, and how that eventually impacts patient care. These days, sometimes I see managers, instead of sitting in their offices, they float on the unit just to ask staff how they're doing and see if there's something they can help with. So that does help a lot, but I don't see that happening often. And then when it comes to racialized staff, wherever it has been education or healthcare, I think there needs to be more attention paid to this community of this group of people, because the stressors are higher. A lot of times, we know that there's anti-racism, and all of that work has to be done, but we need the input of these racialized people to be able to address the situations that are also impacting their mental health. So in addition to all the stresses of the pandemic, we have racism to contend with, and that doesn't help. So we need everybody to be on board to have these conversations and really to come up with tangible solutions and acknowledge your biases and work towards working together as colleagues.
Thank you. I will just point that in the chat, upcoming items that OCAL is hosting have been posted, including our Next.COVID on April 22nd and our May Day events starting, I believe it's the last Friday in April is actually the first one. Kimberly, I know your hand is up, so I will turn it over to you.
Oh, sorry, I just couldn't. I was supposed to stay on the background, and there's Patricia, so I won't say anything. I was just so moved by this, and I know our COVID response team that Patricia helps lead out, Krista, John, Kevin, Val, Pravesh. I just had to say that we started this Science Solutions and Success Stories, trying to bring everyone and our speakers. I can't thank you enough. We started these sessions because we didn't feel like the science was being presented, and we wanted to help more. And it just, this particular subject matter kept coming up that we really needed to touch on that. And we know it was difficult. We've had our own physicians lost people, family members to COVID. We've had our own members of OCAL lost people to mental health. We've had people lose people to regular over COVID, but not had the time to grieve. And these are just really difficult subjects that I wanted to thank Krista particularly for handling so well today. And we thought, sometimes you wonder if the science that you're providing isn't isn't. So I was really happy to hear from Tyler and Tracy and Bridget and John and Krista to know that what we're doing is having a positive effect in the mental health and in the COVID related items. So I'm stumbling over my words, but I just wanted to thank everybody on that COVID response team and in general at OCAL for everything that you do with great passion, because and all of our speakers, how important we really wanted to bring this mental health component to these science solutions and success stories discussions. So thank you.
And thank you to Dr. Tyler Black, Birgit Magba, and Tracy Edward. I see there were some questions we didn't get to, one about the link between environmental stressors in the workplace and mental health, another one about loneliness. I'm so sorry we didn't get to those questions. We are 5 after 3, so I will say that we'll formally end the session, but anyone who has time to stay, we will take those questions now if you have a couple more minutes, but I know that some of our speakers are very pressed for time, so I will say if you need to go, please do. But thank you everyone for staying to the end. Again, like I said, it's 5 after 3. I went a little over, but I really do think those 2 questions were really important things to discuss. So the first one, do you feel the link between environmental stressors in the workplace and mental health is well understood? That was from Kevin Hedges. I'm not sure if that was aimed at any one speaker in particular, but if any of our speakers who can stay would like to address that, please do so.
I can provide some background there if you
Sure,
like,
Kevin.
first. So in Belgium, they're actually imposing requirements for carbon dioxide in certain places. And so, you know, we know in schools, if the carbon dioxide's higher, kids get fatigued, and, you know, there can also be, you know, effects on their neurosystem. So, you know, I'm just wondering that with workers in workplaces, do they truly understand that there's a link between how healthy their workplace is, for example, indoor air quality, and their mental health? That was kind of the question. Thanks. Unless anybody can answer that, I just thought I'd throw that out there.
Yeah,
It's kind of it's come to me more since I've been with OCAG. You know, when we filled out our stress assessment tools, it's made us think a lot more about the impact on our workplace, from our workplace to our mental health things.
Yes, I was going to say in stress assess, we do have environmental factors included. And that's not only because the workers that pilot tested it said, hey, you forgot the stress that's related to having, you know, a noisy workplace, a poorly ergonomically designed workplace, or poor air quality, or that. But it was also included in the CSA standard for the psychological health and safety programs in workplaces. So yes, if you talk to any worker who experiences poor air quality or other factors, they place stresses in addition to the psychological stresses and structural stresses that people experience.
and I think we have a long way to go to educate the workforce about this too. I know before the pandemic, there were a few of our members who would raise indoor air quality concerns, and oftentimes people would wonder, like, if they had particular sensitivities, or you know they must have allergies, or they, you know, there must be a reason, but you know, we would have to educate them about, like, that good air quality is good for everyone, and that's not just the canary in the coal mine, but it is good for people to advocate for better working environments. And with air quality, there's a lot of studies in the education system as well about how the better air quality is also better for student achievement. And that might be a way that we can convince the school boards to address that issue. I was just trying to find it, but one of the school boards just in the last couple days actually announced that they were going to put 1,000 more HEPA units in their school system, which was pretty much doubling what was already there. And I can't find which school board it was, but I think it was in response to the masks being removed, and as a reassurance to the staff and families that they are still trying to address the issues in the workplace. I think parents are becoming quite distraught now, and in the education system, that's sometimes what rocks the boat. In the workplace, oftentimes we see people blaming the workers. If they can't handle the stress, it's the same thing as blaming the worker for not seeing the wet floor and then slipping. Like, the behavior-based safety comes into it, and those programs that target resiliency or only look at the individual cases and not the systemic pressures are very concerning. So I think something like stress assess and having all of the workers answer a survey tool to actually look at some of those work demands and other hazards in the workplace would give data to the employer that they can't ignore, that they can't just say it's the squeaky wheel or that person's always a troublemaker and raising concerns. So I think the survey tools will be very helpful for trying to force the issue to get employers to address those mental health issues that are just kind of covered up and excused.
Can I say something, Tracy?
Yeah.
In regards to your air quality, you guys have the right under the Occupational Health and Safety Act to request an air quality testing under Section 11. The Health and Safety Committee under Section 918F and 19, they have the right to make a recommendation for you to have an air quality testing. And if they are reprising you, you do have right for them not to reprise you under Section 50. They can be charged up to 1.5 for contravention of the Act. So most people need to be educated on their Health and Safety Committee, and workers need to know their right. They have the right to refuse unsafe work, and I do understand teachers and nurses and frontline workers do have limited right. But if you're not giving their proper PPE that is certified under Section 25(1)(a), B, and C, that's a contravention of the Act. And if a Ministry of Labor come in and do an audit ARB list and they're not getting the proper PPE, they can do an audit to see their PO, whether they're getting the right PPE or not. So there's many, many ways that you can go about doing this. And we have a lot of laws to protect us where all of this is concerned. We just need to make sure that we understand our Occupational Health and Safety Act. We have so much protection that when I'm hearing, and it's really boiling my blood because I teach occupational health and safety law, I'm a health and safety instructor. And when I'm hearing that our frontline workers and yourself and my sister, the nurses, they're going through this, it's really disgusting for them to be going through this when we have laws. We're in Canada. And it's not, it should not be acceptable when we have rights. We do have the rights to refuse unsafe work. If you're not getting the proper PPE, you then can refuse. And if they reprise you, you do have rights for them not to reprise you under Section 50. So request, and Health and Safety Committee as well, they do monthly inspection. They can ask for the maintenance record to make sure they're doing quarterly assessment on their HVAC to make sure they're cleaning their vent, making sure that their air quality is fine rather than opening up 20% where it should be open up 80%. Okay.
Yeah, we're just having some problems with the Ministry of Labor enforcing the act, even like when we try our best to do everything that we can using the entitlements in the legislation. And we have to push back, and we do appeal the lack of orders when we can. But one of the main issues, and I didn't mention it in this presentation, is that there basically was nothing learned from the SARS Commission report, which showed that the Ministry of Labor should be able to work with public health and
Correct.
work together to enforce what should be minimum standards, and that there are different standards for the Ministry of Labor to take every reasonable precaution versus the public health standards. But we're finding again that the Ministry of Labor just defaults to whatever public health says is the minimum standard, and then they apply it to workplaces where that shouldn't be the case. So there's been a little bit of progress over the last couple of years, but we still have a ways to go, and there'll probably be another commission after this pandemic is over.
Maybe do a grievance, take it to labor relation officer, and then have all the stats from Dr. Black, Taylor, all the stats that's happening and all the mental stress that people are having from not feeling safe going to work. We should be able to go to work and not feeling, safe at our workplace. They're supposed to take every precaution reasonable in circumstance to protect us as worker, but they're failed to doing so.
And that's a good point about the possibility of using grievances instead of going to the labor board sometimes.
That's right. So what you can do, make a recommendation, take it to the Ontario Labor Relation Board, and make sure you have all your stats and records, and make sure that you have all the employees to back you up, even if you have to have, all of them sign a petition that it's not a safe environment for you to work in.
Okay, I think we just want to quickly get to Debbie's question. I'm so sorry to interrupt. That was a wonderful conversation. Hopefully we got the most out of it that we can, given this short forum, and noting we're over time. So I really want to get to Debbie's question before her battery dies. Debbie had a question around loneliness, and it is such a mental health risk factor, and we saw it in Dr. Black's statistics that he showed at one point. I'm just going to open this up to anyone. In terms of loneliness, what can someone do around that? Does anyone have ideas? I said in the chat just quickly to try and find one other person to reach out to. Even a community of one will help ease that loneliness. But does anyone have any other thoughts around what someone can do if they're lonely to help reduce their risks? Meetup groups?
I know that in our different seminars and training sessions that we were doing, we did try to include more breakout groups and tried to get people more involved so that they could feel connected with the other people and they could share their experiences. So as an organization, that was something that we did, and there are lots of resources that could be sent out for people to reach out to professionals to help them with those concerns as well. It was important, even like especially early in the pandemic, we learned how to socialize online, and we might have to do that again if the sixth wave keeps increasing, right? And not just move on and forget that some people really need that connection, and keep those types of connections happening so that people don't feel so isolated.
I'm just going to read out a link that John put in the chat, and I'm going to read it out in case someone is watching on the Facebook Live and wants to see it. Oh, got something, a pop-up just pulled up. There we go. It's www.nhs.uk/every-mind-matters/coping-with-/coronavirus. That is a lot. I will afterwards go on to the Facebook Live and put it there as well so that it's there. So again, I want to thank, yes, if you don't have a computer, Debbie, that makes it even more hard. Absolutely. And I know that some community groups and religious groups have tried to identify people who might be alone and don't have a computer, but that's a really imperfect system as well, and relies on you being in a community and not very rurally located. So I just want to thank everyone again for attending. For those who made it past the 3 o'clock end, thank you for staying. For those who've already left, if they're watching this later, thank you for watching any part of this. I really am happy everyone was here. Again, the next .COVID is April 22nd. And starting, I believe, April 29th, is that right, John? We have the May Day starting. So that will be Fridays from April 29th onwards through May. 10 a.m. is when those are. So thank you again so very much and have a great day.